Good morning, good morning, listeners, and welcome to the Great Lakes Health Radio program on Power 96.5 FM, 1080 AM WUFO. And I also want to say this is a month of February, and the month of February is the month where the entire country focuses on heart health. To give you a hint about our guest for today, heart health, your heart. I'm your host, Francesca Messiah. And I am so happy you are joining us this year to listen to the Great Lakes Health Radio program. I am always grateful to be able to address you every second and fourth Saturday. And it means a lot to me when I see you in the community and you'll stop and tell me how you enjoyed the program. And remember, what's a question I always ask? If you have a topic that you would like to hear. Who is Kaleida Health? Kaleida Health, we are the hospitals. We're home care. We are long-term care. We're laboratories. We're clinics throughout Western New York. And we're also the Great Lakes Health Cancer Care Collaborative. Who are our hospitals? What are our hospitals? Buffalo General Medical Center, also known as Buffalo General Hospital. Millard Fillmore Suburban. The GVI, Gates Vascular Institute. Oishei Children's Hospital, DeGraff Memorial Park. We also have the Visiting Nursing Association, and we have High Point at Michigan and DeGraff. Those are our two long-term rehab nursing homes. And like I said before, throughout Buffalo and Western New York, we have clinics for adults, children, women. We do not discriminate. Everyone is welcome in our doors. LGBTQ, all races, all ethnicities, abilities, disabilities, everyone is welcome at Kaleida Health. And I have to mention our newest partner, who are they? They're the Great Lakes Health Cancer Care Collaborative. I want to make sure everyone knows that Kaleida Health is hiring. We're hiring for all positions. Remember, we're a hospital open 24 hours a day, 7 days a week. If you're in school or if you need flexibility because of childcare or elder care, remember, Kaleida Health is hiring for all positions, and I mean all. Painters, plumbers, nurses, cafeteria, as well as our environmental services and doctors. We're hiring. And I just want to thank all of our staff for making Kaleida Health who we are. And our guest for today is Dr. George Matthews. Good morning, Dr. Matthews.
Good morning, Ms. Messiah.
And Dr. Matthews is the Chief of Service, Buffalo General Medical Center, Department of Medicine. In other words, Dr. Matthews is a cardiologist, and he's a doctor who we're going to hear a lot about taking care of your heart. And today's topic, how healthy is your heart? We're only in February. We're getting ready to approach Super Bowl. And we want to make sure your heart is healthy to enjoy the Super Bowl. Right, Dr. Matthews?
Absolutely.
Yeah.
And enjoy it in a healthy way.
In a healthy way. And Dr. Matthews, I have to say that I struggle with the show. I know we just had our football player Hamlin, who was injured and had a heart attack, collapsed twice, not collapsed twice, had to be revived twice. And I know that's very important. And we can do another show on that because unless you want to weave it in some type of way to your comments, but I know that's just, to me, a different type of heart problem. And today I just wanted to focus on the heart of our listeners and the average heart, the average person we see walking down the street at the mall. So on that, can you tell us what is the main function of the heart?
Well, thank you again, Ms. Messiah. Let's begin by saying that we can simplify the function of the heart by saying that its main job, its main purpose is to pump or circulate blood. Now, the blood that is circulating does many things. It carries oxygen and it carries nutrients to the various organs. That oxygen and nutrient-rich environment is necessary to allow the organs to function. The heart also, by pumping blood, is allowing the body to excrete or get rid of waste products, a major waste product being carbon dioxide, what we produce after utilizing oxygen and nutrients. And that carbon dioxide is excreted from the body or from the lungs, but it has to be carried by the circulation to the lungs so that it can be gotten rid of. In a similar vein, the heart is able to pump blood to the kidneys and allowing us to produce urine to, again, carry toxic materials out of the body. So the heart does many things, but if we can simplify it, we can say it is a pump, and everything we do to maintain the integrity of that pump is important, whether that's doing bypass, whether that's doing valve surgery. All of this is to maintain the ability of the heart to pump blood and carry oxygen and nutrients to the vital organs.
I just want to say, I know that that's so much of the type of answer that we studied in biology, but for myself and many of our listeners, we haven't been in biology for a while. So I want to thank you for letting us know the main function of the heart is a pump to pump blood and oxygen to the body. So how is it that the heart and blood pressure, like you take blood pressure medication, you take it because your heart's beating too fast? Because I know a lot of us listening, a lot of the listeners, we take blood pressure medicine to keep our pressure down. So what happens if the pressure goes up, and what is this blood pressure medicine for?
Well, let's again return to the fact that the heart is pumping blood, and it's pumping blood through a number of different vessels, primarily arteries that carry blood away from the heart to the organs. Now, these arteries, when we're born and in our early years, are very flexible. They're very pliable. They can expand and contract very easily. And that's a good thing, because the heart is pumping, and over time, there may be a greater need for more blood flow. The heart has to pump more vigorously. The arteries can accommodate that. But as we age, as time goes on, the arteries may become a little bit more stiff. If you've ever had a rubber band, for example, that you've gotten, and it's very, very flexible, very pliable, it can stretch very easily. But as the rubber band, if you've ever left it in a drawer for a period of time and you take it out, it may be very, very stiff, not able to expand very easily. Well, that's what happens to our blood vessels. They become very stiff, and over time, the heart is pumping, but it's pumping blood into this vessel, this tube that is not able to expand in any fashion. And as a consequence, when the heart pumps blood, the artery responds to that by having an increase in pressure. Instead of dilating, as we might expect to accommodate the increased pressure or increased amount of blood flow, the artery is stiff and cannot change. And so the pressure rises. Now, why is that a problem with an increase in blood pressure? Because over time, that increase in blood pressure can damage the wall of the blood vessel, sufficient so that there may be a buildup of material in the wall called cholesterol plaque, or conversely, the wall may be damaged so that it can rupture or form an aneurysm. It can cause stroke, cause heart attack, and we know that for many of the individuals who may be listening to this, that if they have high blood pressure, those are the things that we fear most. So getting back to your question, the reason it's important is to lower the blood pressure is to prevent the damage to the blood vessel over time, which may develop and result in stroke, heart attack, or other vascular disease, such as aneurysm.
So in other words, high blood pressure medication is prevention.
It helps to prevent the bad consequences that may occur as a consequence of an increase in blood pressure.
Now, what does it mean? And I remember years ago when you had congestive heart failure, for lack of a better word, that really made you get a shorter period of life. Oh my, it was for lack of, well, I won't even say the word. So is congestive, are there now better treatments for congestive heart failure? And what does that mean?
Well, let me begin. And this comes back to your first question about what does the heart do? Well, it's a pump. And what we currently describe, or what used to be described as congestive heart failure, we're now just calling heart failure. And what it describes is the fact that the heart and its inability to pump blood to supply the various tissues and organs with the necessary oxygen and nutrients. So that can be from a variety of different causes. But the bottom line is that the heart is unable to pump blood to supply the various organs with their necessary nutrients and oxygen. Now, what does this result in? Well, if blood isn't being pumped adequately, as you might imagine, it may back up, so to speak. So we may have fluid that fills the extremities, the lower extremities, what we call edema, that swelling that may occur because blood isn't being circulated sufficiently to allow excess fluid to be excreted from the body. We may have fluid building up in the lungs, what we describe as congestion, and that's the basis for the old terminology of congestive heart failure. We would have individuals whose lungs are filled with fluid, again, not having the wherewithal to pump adequate blood flow to excrete the excess amount of fluid that may be present. So this inability to pump blood adequately may result in shortness of breath, fatigue, swelling of the legs, fluid accumulation in the lungs, and abnormalities in the heart rhythm.
Yeah, that's important. Yeah, I can just say I've just heard people talk about that, and you're right. They did experience many of those or one of those symptoms. So after age 50, and I know exercise is important at all ages, and I just took 50 out of a hat. So after age 50, how important is exercise? Or the flip side, is there any point in your life when exercise is not important?
Well, that's a wonderful question. Exercise should be a component of our lifestyle from childhood to our senior years. Exercise and the ability to exercise does several things. Number one, it may assist in maintaining strong or satisfactory heart function. Number two, it may assist in maintaining a normal blood pressure. Number three, when we exercise, we know that merely by exercising, that may reduce our risk for a number of vascular issues. And it may, number four, it may also reduce our risk for cognitive impairment or dementia later in life. So exercise is a habit, Ms. Messiah, that we should begin early age and continue as long as we are physically able, because it will allow us to maintain a healthy and fulfilling lifestyle.
And I just have to ask this question. I know there are so many forms of exercise, but I know someone who's they play in bands. So if you're on the stage, let's say every weekend or something, and you're playing the guitar, you're playing the drums, is that also a form of exercise if you're working out and you're part of a band?
Well, it depends on how active you are. And that's a great question, because what we usually like to see is an increase in heart rate for at least 20 minutes, at least 3 times a week. Now, to the extent that the individual may be able to accomplish that through any activity, that may serve the purpose. What we'd like to say is that the individual is utilizing a variety of their skeletal muscles, arms, legs, and the like, to accomplish that. Because again, that is going to be able to increase our functional capacity, our ability to perform activities of daily living. And to give you an example, it's great to be able to walk. And so if an individual says that they are walking for 20 minutes at a brisk pace, that's great. It's great to be able to bicycle. If an individual is able to do that for 20 minutes, 3 times a week, that's great. Or at least 3 times a week, that's great. What we want to do is say, how do we engage those large muscle groups, arms and legs, for a sufficient period of time in a demanding enough activity that we can state that that will allow the individual to maintain their ability to perform their activities of daily living. I had an individual who once said, well, I sit in front of the computer and I'm thinking about things and I'm using my arms, I'm pressing on the keyboard. And although that may have been engaging for his mind, that did not really represent the requisite amount of exercise or energy expenditure to say that that was going to allow him to maintain activities of daily living, be able to stand up, walk briskly, go up a flight of stairs. So we want to say, how do we maintain that ability to perform activities of daily living? And exercise, to your point, are one of the activities or some of the activities that help us to maintain that functional capacity, the ability to function and perform activities of daily living.
Oh, okay. No, thank you. And I know that everyone isn't a Mick Jagger or Michael Jackson. Well, there are singers, but when it comes to entertainers, even if you're playing in a band, just so you know that is a form of exercise. Especially if you're doing at least 20 minutes, maybe you have a solo or something for 20 minutes. But it sounds like 20 minutes is a magic word, the magic amount of minutes when it comes to exercise.
Good question. Yes, again, the reason I say 20 minutes is because what we appreciate is that there is a threshold that it's appropriate to at least attain and to maintain over the time. Oftentimes people will do an activity and then they'll stop, take a break. They'll do an activity, stop, take a break. Now that may not be sufficient enough to say that that's 20 minutes of unencumbered exertional activity. It's similar to, there are many sports where it'll be a lot of activity and then the person will stop, a lot of activity and the person will stop. So what we would like to do is say, let's have that activity sustained over 20 minutes. And to the extent individuals can accomplish that, then they will derive benefit. The problem is we've got to be careful because, and you mentioned Michael Jackson, to be able to get on stage and do a performance for an hour or 2 hours, he had to train a considerable degree. So that, I would suspect, would have served as more than enough exercise activity. By the same token, if we say an individual is doing an activity and then taking a break and then doing an activity and taking a break, that may not allow that sustained level to allow the individual to function.
And it's funny because I think I exercised today for about 8 minutes, so I need to go and just do a straight 20 minutes and call it a day.
Well, at least, and again, the point is, this is like, it's like your bank account. You can put in just enough money to survive, or you can put in enough money that you can not only survive, but you can enjoy what you desire to do. Well, exercise is the same thing. You can bank enough that, it just allows you to perform your activities of daily living. And I have many people who say, you know what, I don't do anything, I'm good. But if they desire to go up a flight of stairs, to play with their grandchildren, to do more vigorous activities, then it may necessitate doing more exertional activities, utilizing those large muscle groups of the arms and legs to ensure that they're able to accomplish those activities of daily living.
Well, thank you. Now, this is one of my favorite Dr. Matthew questions. All the stores sell a variety of salt. So which is better than the other one? I mean, should we use this salt over that salt, or should we just try to avoid or limit salt?
That's a great question. And you know what, Ms. Messiah, who doesn't enjoy salt or salt in some fashion? Now, let me begin by saying when we talk about salt, we're really talking about sodium because that's the table salt and the varieties of salts that we buy in the supermarkets. And we've heard the problem with salt and its component sodium is that contributes to a topic we already talked or discussed in the form of high blood pressure. The sodium may contribute to fluid retention. It may contribute to stroke, kidney disease, and a variety of heart disease. Now, when we talk about salt, salt comes in a variety of different forms. We hear about sea salt. We hear about Himalayan pink sea salt. We hear about table salt. We hear about kosher salt. But in its essence, we're talking about the sodium. Now, this is where it gets really interesting because Americans eat on average about 3,400 milligrams of salt per day. That's about almost, if we think about it, 2 teaspoonfuls of salt per day. It's a lot of salt and a lot of sodium. The American Heart Association suggests that we take in no more than 2,300 milligrams of salt, a little less than 1 teaspoon of salt a day, which still seems quite a bit. What we don't appreciate is that many of our processed foods contain a significant amount of salt. And what foods are we talking about? Well, we're talking about bread. We're talking about processed meats. We're talking about snack foods. We're talking about canned goods. All of those contain salt and sodium. So in answer to your question, is there a good salt? Probably not. The important aspect is to decrease the amount of salt we take or sodium we take into our body. The differences in salt and taste and appearance of salt, that's not related to the salt itself. That's related to the manner in which the salt is refined. Most of the salt that we have on our table is from mines, salt mines. The salts that are described as being, specialty salts, they may come from the ocean or lakes that have a significant salt content, at which time the water is evaporated and what remains is that salt. But the essence is, and the bottom line is, the salt is the same. So there is no safe salt. There is probably a safe amount to consider when seasoning our food.
Thank you. And I know we only literally have a couple minutes left. And this question is really for a friend of mine friend of my family's. Last year, she was shoveling the snow. She fell out. She had a heart attack. She said she didn't feel anything. She just passed out and was at the hospital for several weeks. Are there just, because we only have we have less than 2 minutes. What are some of the common warnings of a heart attack?
Great question. Let's talk about the commonly understood heart attack signs or symptoms include chest pain or discomfort. And I'll say discomfort because when we talk to individuals about what were your symptoms, they'll say it may have felt like a pressure or a squeezing sensation in the center of the chest. They may say they felt a fullness in the chest, or they may have had indigestion. All of those can be symptoms of heart-related illness. The individual may have shortness of breath. They may have discomfort in the jaw, the neck, the back, the arm, the shoulder, all of which may indicate the potential for a heart-related issue. The individual may feel nauseous, they may have vomiting, they may feel lightheaded, or very tired. They may even break out into a significant perspiration or sweating. All of those are signs and symptoms. Now, you mentioned that the friend of yours was a woman, and women may have these symptoms, but interestingly enough, they may attribute their symptoms to acid reflux, the flu, aging. So in particular, for our women listeners, if you have any of those symptoms, chest discomfort, shortness of breath, acid reflux, flu, aging, or feeling very tired, fatigued, attributed to aging, lightheaded, any of those, be on guard for the possibility of a heart-related illness.
And call your primary care physician.
Yeah, call your primary. That's exactly what I was going to say.
What if their primary doesn't have any spaces? Should they go to the emergency department?
By all means, going to the emergency department is most appropriate. And Ms. Messiah, the important takeaway message is heart disease is the #1 killer of women in the United States. Unfortunately, women, they have so many things on their plate. They attribute their symptoms to other issues and not necessarily the heart. But we've got to put heart disease as the top of the list.
Yes. And even if you are, I remember years ago, a friend of mine, she was probably in her 30s or 40s at the time. She was in the fitting room trying on clothes, and she was part of a running team. She had a heart attack, and thank goodness she was in the field, and she kind of knew in the field of medicine, and she knew she thought she was having a heart attack. So even if you're super healthy, the heart doesn't know that, right?
Exactly. And, heart issues can happen to anyone at any time and any place. So what we say is be on guard. Don't presume, and to your friend's credit, she identified this as an abnormality and knew what to do.
Yes. And on that note, Dr. Matthews, we are out of time. I want to thank you so much for being our guest this morning on the Great Lakes Health Program. This is American Heart Awareness Month, but really every day's Heart Awareness Month.
Thank you, Ms. Messiah. Well stated. Every day should be Heart Day.
Thank you. And on that note, I just want to mention to our runners, our listeners, and the audience who are runners, remember the Buffalo Marathon is coming up Memorial Day weekend. I will have more information on the marathon in 2 weeks. And again, I want to say thank you for joining us for our program today. And next week, you'll hear from my esteemed colleague, Cindy Bass from ECMC. And in 2 weeks, God be willing, you will hear from me on the Great Lakes Health Radio Program. I'm Francesca Messiah. Thank you, and bye-bye. Be healthy. And now on to part 2. Good morning, Kelly Cardome. How are you?
Good morning, Fran. I'm doing well. And yourself?
Oh, I'm doing well. And listeners, I just want to say welcome to the second half hour of the Great Lakes Health Radio Program with Kaleida Health. And if you're just tuning in, it's 7:30 in the morning. I'm Francesca Messiah, Manager of Workforce Development from Kaleida. And our topic for today, as Kelly and I, we talk a lot on nutrition. And our topic for today, seeing as we are approaching the holidays, is type 2 diabetes and prediabetes and eating during the holidays and into the new year. And the reason for this topic, and Kelly will correct me, I just want to say Kelly is a clinical nutrition and diabetes program manager for the primary care practice of General Physicians. She has her master's. She's a registered dietitian. Kelly has about 5 initials, degrees after her name, but she is soon to become Dr. Cardamone, right?
Yes. I'm working on my doctorate in clinical nutrition. So hopefully I'm more than 2/3 of the way there. So we're making progress. It takes a while.
It does. And now, Kelly, what is it you told me? One in how many people are diagnosed with pre-diabetes or type 2 diabetes? What was that?
Yeah, so about 11% of the population currently has diabetes, but about 1 in 3 individuals under the age of 65 has pre-diabetes. So if you think about combining those two numbers, you have 40% of the population, more than 40%, that is experiencing insulin resistance. And really need to be mindful of their diet and behaviors, exercise and things like that to help control their prediabetes or diabetes.
Thank you. And so if someone is pre-diabetic, and I get this, I hear this a lot, how close, I guess it's the numbers, right? It's in your blood test, but how close are they then to possibly becoming type 2? Because I have a lot of people out in the community, and when I'm doing outreach, and I'll ask them, do they have diabetes? And they'll say no, but they're pre-diabetic. What does that mean? And how long does it take to become type 2 diabetic?
So it's a great question, and I'll share some statistics with you. So I will share it's not a straightforward answer because there are many factors that are involved. So I'll start off with the factors, and then I'll give you some of the stats. So to just develop diabetes, right? So again, that puts you in that risk for developing prediabetes. So family history is a huge factor. So if you have a first degree relative that has diabetes, you have a 25% greater chance of developing diabetes if you have two relatives. So it kind of increases based on how many people in the family. So a stronger family history. If you have a BMI over 25, so that's considered that's the body mass index, height and weight. Between 25 and almost 30 is overweight, 30 and above is obese. I just want to throw another stat out to you. We've got over 40% of the population meets the criteria for obesity. And then you have less than that, but over 35%, give or take, now that is overweight. So we have 3/4 of our population that meets that BMI of over 25, right? So that's a risk factor. Just age alone, you can't change that. 45 and older put you at risk. But things like your BMI, you can change. Family history and age, you cannot change. But being inactive, that's a risk factor. You can change that. Smoking, having PCOS, which is polycystic ovary syndrome, or having a history of gestational diabetes, put you at higher risk. So gestational diabetes is diabetes while you're pregnant. That alone puts you at a 60% we call lifetime risk. So it increases your lifetime risk of developing diabetes. Now, to put that into perspective, because you asked about prediabetes, so I kind of reviewed these risk factors. Well, now we get into, if I have prediabetes, what are my chances? Well, you want to look at all those risk factors I just went over. And it's like, hey, which one of those can I change? I can change being inactive. I can change the way I eat, which should ultimately change or help improve my weight or BMI, right? If I'm smoking, I can quit smoking. But if you are, according to the American Diabetes Association, if you are 45 years old or older with prediabetes, your 10-year risk of it turning into diabetes is about 9 to 14%.
Wow.
So, yeah, but I will share that the older that you get, it does increase that risk. But there are people that, I don't want to say hang out, but stay in that prediabetes range most of their life. So there's a lot of it in your hands.
Okay. No, thank you. And what made me think about this topic for today was holiday and New Year's. And because the number one New Year's resolution, people always say they're going to either exercise more or diet. So I said, seeing as this is December, why not get a jump start? So let's talk about starting with the meals, breakfast, lunch, and dinner. And I've heard you don't necessarily need breakfast, lunch, and dinner, but that's neither here or there. But what should you do this if you like, let's say scrambled eggs, you like butter, you like cheese, and your eggs, maybe you put a little something in them. So in terms of your meals, breakfast, lunch, and dinner, what should we be cognizant of? What should we say, do this or don't do this and now do that, something like that?
Sure. So eat this, not that.
Eat this, not that. Exactly. Yes.
So yeah. So the thing is, and you're right, we don't necessarily need 3 meals. We could do a whole nother show on that. I do like intermittent fasting. I definitely think it has its place and its benefits. But again, that's a whole nother show. But you know, when
Okay.
you're looking at your meals, the biggest thing to remember is you want to balance out your meals. And so I'll say, eat this. Make sure you have a protein with every meal. But as soon as I say protein, most people think of, chicken and meat and burgers and meatloaf, and that's not it. Protein sources can also come from beans, legumes, nuts, seeds, tofu. So on that note, I do tell patients, try to make half of your protein intake plant-based. Doesn't have to all be animal-based. Or eggs is another one that's pretty common. So you want to make sure you have protein in those meals. If you can add vegetables to your meals, go for it. I just made an egg white bake, and I do egg whites, and I use what they call nut cheeses. So they're cheese that is made from nuts, and I put tons of vegetables in there. So if you do things like that at breakfast, lunch, and dinner, that fiber is great for your gastrointestinal tract, good for your cholesterol, regulating blood sugar, satiety, just overall keeping you nice and healthy, because we don't eat enough vegetables. So try to get, I should say, fruits and vegetables in at each meal. And then it's okay to have the carbohydrates, but even if you're going to do something like an English muffin or pasta or rice, you want the whole grains, because you want, again, that more fiber. So that's kind of what you want to focus on doing. Now, what do you want to avoid? You really want to be mindful of, as Americans, I've mentioned this before, the standard American diet, it's SAD, right? That's what it stands for, the acronym. We tend to eat a lot of saturated fat, and we tend to eat a lot of fat overall. And there is a difference between fats, butter, oils. Like if you're looking at meat and you see all the grease and the fat, those aren't great for you. So you want to choose the healthier fats like avocados, nuts, seeds, olive oil, avocado oil. If you're using a spread, use a vegetable spread that doesn't have the hydrogenated oils, that's made with olive oil or other vegetable oils. You want to try, this time of year, everybody's into baked goods and cinnamon buns and, things like that for breakfast. Don't start your day off with sugar. Start your day, because it really does kind of sabotage the rest of the day for many people. And then bottom line is portion sizes. Try to space out, don't make your heaviest meal at night. Especially people tend to eat late this time of year if they're getting ready for holidays and doing things, because it's really can be disruptive to sleep. So really try to space out those meals. And if you're going to have a larger meal, make it lunch or even breakfast over dinner.
Okay. Now, and then I also want to say, you say don't have your heaviest meal at night, but that doesn't mean if you're having a light meal to then have a nice slice of chocolate cake, right?
Right. Absolutely. And that's the thing, where this time of year, food should be enjoyed, and it's okay to have some cookies or cake or dessert. But, I call it the 80-20 rule. 80% of your diet should be whole grains, fruits, vegetables, lean proteins. Allow that 20% for flexibility. For some patients, I even recommend 10%, depending on what their current health status is. But that's where you have a little flexibility. Have a taste of something. Don't eat half of a cake.
Right. Okay. And I have a question. Does avocado oil taste like an avocado?
No, I use it all the time. I actually bake with it. So if I was baking something and it asked for vegetable oil, I use avocado oil quite often. And it has a higher smoke point than many of your olive oils. So if you're going to use a little bit in a pan, if you're lightly pan frying or sauteing, avocado oil is a great choice. It has a much milder flavor than most olive oils.
Oh, okay. All right. I'll have to go out and buy some. I always wondered would it taste like avocado. How about if someone is concerned about his or her cholesterol? Is it the same type of what you should watch, or is there anything, if you're looking at your cholesterol, that you should pay closer attention to? If you somewhat know your numbers, is there something you should pay closer attention to?
Sure. The biggest thing, now some of it can be familial. So if you have a family history, it makes it a little more challenging, but your provider or doctor will be looking at the ratio, looking at the entire lipid panel from total to triglycerides. They look at everything, right? But what you can do on your end is, again, that fiber is extremely important. It can help to lower the bad cholesterol and total cholesterol. So eating things like oatmeal and whole grains, avoiding white processed foods, again, those fruits and vegetables. You really want to limit the saturated fat. So when you are even choosing protein sources, try to choose leaner proteins. Fish is a great choice. If you're looking at a diet to follow where we've had some great research on, there's many diets out there that work, right? And you'll even hear about ketogenic and all that. The bottom line is I tell everybody, you want a diet that you can stick with and that is financially, right, you can afford to follow. Mediterranean diet is great. So it focuses on those good fats like the avocado, the nuts, the seeds, not a lot of cheese. Cheese has a lot of saturated fat. So when you are looking at like a food label, you don't look at the cholesterol on a food label. The cholesterol in a food does not raise your cholesterol, but the saturated fat, the trans fats do. So that's where you want to limit. And that's the bad fat. That's the stuff that's solid at room temperature, like butter, right? Or like shortening. Those are all solid at room temperature.
People talk about plant-based. You see plant-based, everyone has plant-based. But I don't really know. I don't know even if our listeners really know. What is plant-based? We have plants in our home, and I don't think they're talking about eating our plants. What is plant-based? What does that mean?
Yes, I would not advise, chewing on your front lawn or eating your, eating your plants in your house. But plant-based, if you think about it, really are things that are coming like from the earth or are grown. So it's really avoiding anything that comes from an animal. So your eggs, your chicken, your dairy products, those are all butter. Those are all animal products. So plant-based really for the most part is anything other than that. I want you to think of it as focusing on, again, fruits and vegetables, right? They're grown. And then also your grains, again, your whole grains, but choosing, everybody gives potatoes a bad rap. White potatoes are great for you. They're really high in potassium and the skin has a good amount of fiber, sweet potatoes. So it's avoiding or limiting, I should say, products that come from an animal. And it's, I tell everybody, so that rule of like at lunch or dinner, make half of your plate vegetables, meaning do salads, do roasted Brussels sprouts and, be adventurous. The plant-based really, there's some really great research on plant-based and how it can improve your health. And a lot of times I think people think it's more expensive. It's actually less expensive. Things like beans and black beans and fava beans and garbanzo beans or chickpeas, they actually are a lot less expensive than meat products. So that's what plant-based is primarily, but I just want to throw out one thing here. You're going to see there's a lot of what we call these meat analogs or these kind of fake meat products, right? And I won't give any specific name brands, but you're going to see like these burgers that taste like beef or the sausage, or that is not healthier either. And so if you're doing a true plant-based diet, you want things that are less processed. It's okay to have those things once in a while, but you are shifting from having, let's say, grass-fed meat, or people are having fish. Now they're going plant-based and they're eating these processed fake foods. And they tend to be really high in saturated fat because a lot of them are made from coconut oil. Not a great choice either. And they're expensive.
Mm-hmm. Yes. Yeah. Yeah. So coconut oil, sometimes it's used as a hair conditioner, but it's not good to eat.
Yeah. I use it sometimes when I'm making popcorn for my kids. It gives it a nice flavor, but it's a tablespoon once in a while, but you are right. It's great for your skin and hair if you want to use it.
But not for your arteries necessarily.
No, not for your arteries.
How important is drinking water? Again, it's holiday time. Sometimes we're just, there's just more spirits. There's more alcohol at parties. How important is drinking water when you're diabetic, pre-diabetic, or watching your cholesterol? Is water important to drink?
Absolutely. So you can go quite a long time without food, but you cannot go without water because your body can't just make water. And you use it, when you're breathing and you're constantly releasing or losing water, I should say. So about 60% of the adult body is water. And it's really not even just important for diabetes and everyone, even including children. So it keeps the joints lubricated. A lot of times if you have migraines, headaches, your body wants to stay hydrated. And it's great for the kidneys. So it is really important. You'll see this 8 glasses a day. There actually is no scientific evidence that says you need 8 glasses or 64 ounces a day. We base it on weight. And you, by the way, can drink too much water. I do have some patients that have been drinking 2 to 3 gallons, which is an excess. You don't want to do that. But recommendation, I do tell most people aim for 64, even up to 100 ounces a day. Or if you've got those 16-ounce bottles, at least do 4, if not 6. And you have to remember, though, Fran, that fluid to keep you hydrated comes from fruits and vegetables. It can come from if you drink green tea or coffee or soups. Anything that's really liquid at room temperature will count as hydration. But aim for a good 48 ounces of straight water. I mean, you can flavor it a little bit with lemons, limes on a daily basis. And I will just say, though, if you have severe or advanced kidney disease or other conditions, sometimes, or you're on a diuretic, sometimes your provider will tell you to limit water intake because of your medical condition or fluids in general.
Mm-hmm. And I've noticed that some of the flavored water, they have in the grocery store, there's a whole section now of things you can flavor your water with, but some of them are loaded with sugar.
So your best bet for that would be, again, throwing in a couple lemon slices, cucumber slices, cinnamon sticks. You can be really creative. If you have pre-diabetes or diabetes, I would avoid those that have sugar in them. And those would be a lot of the powder mixes and, things that you can add in, more of the sports. I have people that drink sports drinks and they don't exercise. And sometimes you need them for other medical conditions, but most people don't need those. But choose the ones that are, they'll be made with artificial sweeteners, but there's a couple of them out there that are made with like stevia and monk fruit. So if you want to choose a more natural, non-caloric or non-nutritive sweetener, and you just put a couple drops in your water to flavor it, that is great. My golden rule, as I think I've shared many times, but there could, be new listeners, is when you're looking at something per serving, go to look at the total sugars on the nutrition facts panel, keep it under 10 per serving. So single digits only. And that's just an easy guide for people.
And I noticed that I've even started the other day, I was in a store and they had soup, different, brand name soups on sale. And one of them had 3 different types of chicken noodle. And I was amazed at the sodium content and how different it was for each. 2 of them were like 800 milligrams. And the other one was like 420 milligrams of sodium in that can of soup. And I chuckled because it was all the same name, chicken noodle. But reading the labels, I would say if you're looking for a New Year's resolution, it would be to read labels. Begin reading the labels.
Absolutely.
I know the print can be tiny, so you might have to bring your glasses or something with you. But reading the labels is very important. What do you think about how important is reading the labels?
Very important. So anyone that comes into the office to see me, or the diabetes classes that we offer, it is one of the foundations of nutrition is reading labels. Now, ideally, we'd like you to eat less processed and labeled foods, but that's not realistic in today's world, right? With convenience, and we're busy but read the labels when you go to chain restaurants or fast food places. They will have the nutrition information available from all of them, from coffee shops or coffee places to food places. Read what's in what you're eating. The biggest thing, as you mentioned, is sodium, especially soup, condiments, and things like that. And most Americans do get too much sodium. And it's really important, of course, to drink water when you eat more sodium or ingest more sodium. But we do tend to have too much of that. So the nutrition facts panel should be the first thing you go to when you pick up a food. Maybe after you've decided the price, or as you said, Fran, you're standing there and there's 3 or 4 different choices. I have to do the same thing. A lot of us get attracted to the marketing or like the advert, what's on the label, the pretty stuff. Don't worry about that. And don't worry about the claims that they make even. Get past that, jump right to that food label. Look at the sugar, look at the fiber, the saturated fat, and the sodium. And some of you might have to look for other things like if it's phosphorus, potassium, things like that. But for most individuals, those are the things that are targeted that you should be looking at.
And Kelly, I'm going to ask you one more question before we talk about your office hours and taking in patients. Holiday snacks. What are some alternatives? Charcuterie board, those cheese and cracker boards are just loaded with lots of no-nos, correct?
They are, but you will find one at my house when I have a holiday party. It's having options. So when I put cheese on there, I also put lower fat cheeses on there. I have nuts and I will add, and I don't have like honey roasted, sugar coated. I have raw nuts, maybe lightly salted. I like to put olives out. You will always find grapes or apples on my platters because I like to have those fruits mixed in. When I have crackers, I also give the option of seeded crackers, whole grain. I'll throw, like in a sense, like those Triscuit or wheat thin, and there's versions of them out there, but those higher fiber crackers. So I always put them on there. Yeah, there's a way to make it healthy, actually, or healthier. But if you're asking for an alternative, vegetable platter, always, always, always be mindful of the dip. But when you're making dips and appetizers, if you can cut down on the butter, if you can do lower fat using fat-free or low-fat sour cream, lower fat cheeses, that's how you save. Cut down on the sugar when you're baking.
Yes. You know what? And I do that a lot. And people will still say, those peanut butter cookies are so good. But I don't tell them that I cut down tremendously, with the nuts. So with the nuts that I cut down tremendously with the sugar. And I don't want to miss one of the most important parts. If someone wants to meet with you, find out more information, because we just skimmed the surface today about nutrition and diet. So if someone wants to get in touch with you, how would they do that?
Sure. There are a couple things. So to meet with myself or anybody else on my team, the dietitians and my entire team, we're all diabetes educators as well. Or if you are interested in attending diabetes classes, you do have to be diagnosed with diabetes. But the option is you can either go online to the general physician website, which is gppconline.com. The other thing you can actually do, though, is call this number. It is 716-800-2273. So that is 716-800-CARE, C-A-R-E, which equals 2273. And it's option 5 to speak with our admin assistant, Christy.
What should they bring with them?
So before that first visit, the biggest thing, and our admin, she will take care of this. For some patients, you will need a referral from your doctor. I have never had a provider not provide a patient with a referral to see a dietitian when they ask for it. But we will ask for labs. So we want to look at what's your lipid panel, glucose, A1C, renal function. We like to look at all that, and definitely a list of medications that you are prescribed, and we'll talk about if you're taking them, even though they're prescribed. But those are the most important things for us. She'll gather insurance information, but for us, I like to look at medications, labs, and then if you want to bring even questions that you have, and then write down typically like what a day or two looks like, what you're eating, because that we're going to ask you that anyway. It's really helpful.
I was just going to say, should they put something like what are their favorite foods that they enjoy eating? What are the favorite foods they enjoy eating? Would that be helpful?
Absolutely. And we'll dive in with our questions because we look at the whole picture. Who else is
Yeah.
in the household? What equipment? We look at everything. But yeah,
Right.
anything like that. Like these are important foods and I would like to not have to give these up. How can we modify things? Yes.
Yeah. And just a quick funny story. I remember when my mother, when she was living, my father and I would not buy sugar because she would turn anything. She would have a prune pie. She would turn anything into sugar, and we knew that she was pre-diabetic. No, she was type 2 diabetic, that with diabetes, and we just used to laugh. And she always got a kick out of telling everyone that we would not bring sugar in the house. Yeah. So, but anyway, Kelly, I just want and give us that phone number one more time.
Sure. 716-800-2273. So 716-800-2273.
And what would be your message about just your one word message or 2 words about eating during the holiday season with type 2 diabetes or pre-diabetes? What would you say? What's your tip that you stick by?
So the tip to stick by is make sure to enjoy the holidays. Doesn't mean you cannot have your favorite foods. Have them in a small amount. Like you can have a taste of something, but still try, again, my 80-20 rule. Try to keep 80% of it healthy. Allow yourself that flexibility, and don't feel guilty about enjoying the holidays.
All right. Well, I want to thank you, Kelly Cardamone, for being our guest today on the Great Lakes Health radio program. And our topic has been type 2 diabetes, eating during the holidays and New Year's, and pre-diabetics. So I want to thank you for being our guest.
Thank you.
And I want to also thank our listeners for listening to the Great Lakes Health radio program here on Power 96.5 FM, 1080 AM. And in 2 weeks, God be willing, you will be hearing from me, Francesca Messiah from Kaleida Health, Manager Workforce Development. Bye-bye.